What is laryngitis? Laryngitis is inflammation of the larynx voice box and is a common cause of hoarseness or a hoarse voice. When the voice box or vocal cords are inflamed, it can cause hoarseness, loss of voice, and a sore, dry, or itchy throat. Viral infections, allergies, inhalation of irritants or medications, smoking, and voice overuse can cause laryngitis. Treatment for laryngitis focuses on relieving symptoms and healing the vocal cords, and may include at-home comfort measures or medications depending on the cause. Laryngitis affects people of all ages, though it is most common in adults, especially those who use their voices extensively, such as singers and teachers. 2 types. Laryngitis can be acute, lasting for a short period, or chronic, persisting for weeks or months. Identifying the type of laryngitis you have helps healthcare providers tailor the most appropriate treatment plan and offer targeted interventions to relieve symptoms and promote healing of the vocal cords. Acute laryngitis is temporary and typically lasts 1 to 2 weeks. Infections and trauma or injury to the voice box are common causes of acute laryngitis. Chronic laryngitis lasts 3 weeks or longer and often develops gradually, with symptoms coming and going over a long period. Smoking, allergies, acid reflux, and vocal cord damage are common causes of chronic laryngitis. Laryngitis symptoms. The most recognizable symptom of laryngitis is a hoarse or raspy voice. Sometimes the voice may become extremely weak, almost like a whisper, or disappear altogether. Other symptoms of laryngitis include sore throat. Laryngitis can cause a sore, dry, or scratchy throat. Dry cough. Laryngitis can occur with a dry, persistent cough that may worsen as the condition progresses. Throat irritation. The inflamed larynx can cause irritation or tickling, leading to frequent throat clearing. Difficulty speaking or vocal fatigue. People with laryngitis may struggle to speak or may experience fatigue while talking.
What causes laryngitis? Laryngitis occurs when the voice box larynx is inflamed. Environmental and lifestyle factors that irritate the voice box or vocal cords can lead to laryngitis. Acute laryngitis causes. Acute laryngitis is temporary, lasting 2 weeks or less. It is most commonly caused by viral infections, particularly upper respiratory infections such as the common cold or influenza flu. These viruses infect the respiratory tract, leading to inflammation and swelling of the vocal cords, resulting in hoarseness and loss of voice. Other causes of acute laryngitis include talking, shouting, or singing for extended periods, injury or trauma to the throat, dehydration, bacterial or fungal infection. Dry air. Acute laryngitis is most common in winter months. Coughing. Chronic laryngitis causes. Chronic laryngitis persists for 3 weeks or longer and is often associated with chronic health conditions. Common causes of chronic laryngitis include acid reflux, GERD, allergies, asthma, bronchitis, excessive alcohol use, frequent voice overuse, e.g., teaching, singing, public speaking. Laryngeal cancer. Prolonged exposure to chemical irritants, recurrent sinuses, sinus infections. Smoking or exposure to second-hand smoke, vocal cord nodules, nodes, or polyps. Risk factors. Certain factors can increase your risk of developing laryngitis, such as extensive use of your voice, e.g., vocally demanding professions, having a respiratory infection, e.g., cold, flu, smoking and exposure to second-hand smoke, chronic throat clearing, certain medical conditions, e.g., gastroesophageal reflux disease, asthma, allergic rhinitis, nasal polyps. Diagnosis. To diagnose laryngitis, your healthcare provider will perform a physical examination and assess your medical history. They will ask about your symptoms, including when they began. They may ask whether you've had a recent upper respiratory infection and whether you frequently use your voice or are exposed to chemicals at work. Your healthcare provider will look at your throat to identify signs of inflammation, such as redness and swelling. While laryngitis is often diagnosed based on symptoms, your healthcare provider may order a laryngoscopy test to confirm the diagnosis and determine the underlying cause. A laryngoscopy involves a flexible or rigid scope long, thin instrument with a light and a camera attached. This tool allows them to visualize your larynx and vocal cords too. See inflammation, swelling, or structural abnormalities, e.g., polyps. Treatments for laryngitis. Laryngitis treatment focuses on relieving symptoms, promoting healing of the voice box and vocal cords, and addressing the underlying cause. Treatment approaches vary based on the type, severity, and cause of laryngitis, and may include at-home treatments, medication, or voice therapy. At-home treatments, most cases of acute laryngitis are self-limiting, meaning it resolves with time and self-care. At-home treatments for laryngitis can include voice rest. Resting your voice gives your voice box and vocal cords a chance to heal. Minimize talking, whispering, singing, and other activities that can strain your voice when possible. Hydration. Adequate hydration by drinking plenty of fluids can help keep your vocal cords lubricated and smooth your throat. Humidifier. Using a humidifier or inhaling steam can add moisture to the air, which helps soothe the throat and alleviate dryness or irritation. Gargling with salt. Gargling with a warm saltwater solution can help reduce inflammation and soothe the throat. Quitting smoking. Smoking can increase the duration and severity of laryngitis and cause coughing, leading to further larynx irritation. Quitting smoking and avoiding exposure to second-hand smoke can promote healing. Medication. Medication isn't always needed for laryngitis. However, if you are experiencing pain or discomfort and would like additional relief, talk to your healthcare provider over over-the-counter pain relievers, such as nonsteroidal anti-inflammatory drugs and SAIDs, or throat lozenges, which can help relieve throat discomfort and reduce inflammation. Throat sprays or gargles may provide temporary relief as well. It is also important to treat underlying causes, if relevant. Allergies, acid reflux, or other underlying conditions contributing to laryngitis may require specific treatments, such as antihistamines or medications to reduce stomach acid. Viral laryngitis is the most common type. Less commonly, a bacterial or fungal cause may be identified by your healthcare provider. In these cases, antibiotics or antifungal drugs may be used. Antibiotics treat bacterial infections, and antifungal medications can help clear a fungal infection. Voice therapy, if you have chronic or recurrent laryngitis, your healthcare provider may refer you to a speech-language pathologist for voice therapy. In voice therapy, you will learn proper vocal techniques and behaviors to optimize your vocal health and prevent future vocal cord injuries. Voice therapy treatment programs vary, but generally involve 1 to 2 weekly therapy sessions for up to 8 weeks. Prevention. It is not always possible to prevent acute laryngitis, mainly because respiratory infections commonly cause it. Preventive measures may lower your risk of laryngitis or help prevent chronic laryngitis. These include: use proper vocal techniques, such as speaking at an appropriate volume and avoiding yelling and excessive throat clearing. If you use your voice a lot for work, take breaks to rest. Particularly when your voice feels tired or hoarse, drink plenty of water throughout the day too. Stay hydrated. Limit your exposure to irritants that can cause throat irritation, such as smoke, chemicals, and pollutants. If you have allergies, reduce your exposure to known allergens.